Tarsal tunnel. What is a tarsal tunnel? Tarsal tunnel syndrome is the compression of the main nerve, posterior tibial nerve, that passes under the medial or inside part of the ankle. Peripheral nerves such as the nerves in the feet are richly endowed with their own blood supply and have the ability to stretch or shorten along with the movement of the accompanying joint, in this case the ankle joint. When the nerve is entrapped in its tunnel, the swelling that occurs around the nerve and the ensuing scarring of the nerve inhibit blood flow to the nerve. As the ankle joint continues to move, the nerve is further compressed, and the ability of the nerve to properly function is diminished. Causes of this syndrome include trauma such as a fall, acute or chronic pronation of the foot, that creates excessive pressure on the inside of the ankle. Additionally, a tendonitis of the tendon that passes through the tunnel can create similar symptoms, because as the tendon swells it creates excessive pressure within the confined area, putting pressure on the nerve. A condition, such as a ganglion cyst in the canal, will also put excessive pressure on the nerve, again creating similar symptoms. Symptoms include burning or numbness, usually on the bottom of the foot. It may be worse when standing or walking. There may also be muscle weakness of the muscles that run through the bottom of the foot. The distribution of pain or numbness is dependent on which nerve branch of the posterior tibial nerve is most affected. For that reason, all of the foot, or only certain parts of the foot, may be affected. Diagnosis is made by the history of the pain or numbness in the area of the distribution of the nerves, on the bottom of the foot. Tenderness may be noted over the nerve, just below the ankle joint, on the inside portion. Tapping with a finger may send sensations both forward into the foot and backward up the leg. This is known as a positive Tinel sign. There may also be muscle weakness, particularly in the inability to bend your toes in a downward fashion. Your doctor may also order an electromyogram, EMG, which may reveal decreased nerve conduction across the tarsal tunnel. If your doctor feels there may be a soft tissue mass, he may order an MRI. Other foot conditions may mimic the symptoms of this condition. These may include radiculopathy, nerve impingement in lower back, diabetic neuropathy, peripheral neuropathy, rheumatoid arthritis, vascular disease, Baxter's nerve, heel neuroma, plantar fasciitis, scar tissue from previous trauma or surgery, ankle edema, swelling, and possibly a growth like a ganglion cyst, or lipoma, fat tumor, in the canal. Treatments include the use of orthotics when the origin of the problem appears to be excessive pronation. An orthotic will prevent the foot from overpronating and thus relieve the pressure on the nerve. If the origin of the problem is traumatic in nature, a short leg walking cast may be indicated, as the cast will prevent the ankle from moving at all, and will allow the inflammation in the tarsal tunnel to subside. Adding a heel lift to the walking cast can be helpful, as the slight plantarflexion that is created also helps reduce the tension and pressure on the affected nerves. Along with the above treatments, your doctor may also prescribe oral anti-inflammatory medicine to help reduce the inflammation. Oral or injectable steroids may also be of benefit. Transcutaneous nerve stimulation may be helpful as a supplemental treatment as long as the underlying cause of the tarsal tunnel is being addressed. If none of the conservative avenues work, then you must consider surgical intervention. Read the full article at www.fot-pain-explained.com/tarsal-tunnel.html